We do have a quorum, Ms. Jernigan. Okay, very good. Make a motion to, is there a motion to adopt the agenda?
I so moved.
A second. Any discussion on this agenda item? All right, good. All in favor, aye?
Aye.
Aye. All right, next one, adoption of minutes. Is there a motion to adopt them?
So moved.
And second, I'll second it. Discussion on the minutes? All in favor, aye?
Aye.
Aye, good. All right, next item is a discussion of action items. Mr. Joe Sanchez, Leroy Deschamps, and Ms. Tanisha Gibbons. Update of executive order.
Okay, thank you. Just to let you know, the governor has extended the executive order. As of December 8th, it's been extended for another 15 days. So the executive order has been extended by the governor. And we'll continue to follow that. And what we'll do from this, if it's okay with the chair, is we'll go right on with B, okay? And what we'll do is get updates there. And first of all, we will turn it over to Joe Sanchez that will update us on Comet operations.
Thank you, Mr. Sanchez.
Thank you. Good morning. Good morning, Mr. Chair, and the board. To update on the items, I would like to touch on the food delivery service. Okay, for the month of November, we transported 85 food deliveries. This number is declining as some of the participants of the program are finding other ways for hot meals. So that is the decline in the reason for decline in the ridership. So 85 for the total of November. So far, it's looking about the same. I believe we're at 41 for this month in December. So which is you know, a positive sign that the food delivery program is increasing again. I would like to touch on the dark office spacing of for those social distancing. I've received a tentative schedule that TCS, our subcontractor, has provided to reflect minimum capacity in the office during business hours. They redid the schedule with having some of their team members off, so that way there isn't overcrowding or space constraints in the office. That's what I have there. And again, it's a working schedule. It's not final. It's just tentative. Once we have something final, we will present that to Ms. Gibbons and Leroy for approval and for any feedback they may have. I would like to discuss regarding our vehicles, our barriers on our vehicles.
Oh, before we get there, Joe, can you go back to the vehicle cleaning?
Okay.
And let's talk about overcrowding on the service.
Okay. All right, absolutely. So as mentioned, the vehicle cleaning, so far to date, and again, the data management system that we are currently using, our team is entering the checkoff sheets that our subcontractors are doing, and so that way we have a more accurate and detailed report showing the number, vehicle type, what vehicle number, and what data plus with detail. So far, for the month of November, we have 203 details performed, 136 fogging, and 607 interior and exterior cleanings performed on the fleet for November. And again, our team is entering the information into the data management program. So this number will increase as those entries are being made. But as of right now, so that way we have something to present and to the board, 203 details, 136 foggings, 607 interior, exterior cleanings. With that, our bus wash is currently at 95%. We've had the solenoid installed in the bus wash. We are also dealing with the vendor to send a technician out so that way it can be calibrated, so it can be functioning at 100% as expected and perform the job that the bus wash is to be doing. Right now, to support that 5% gap, the service line are manually brushing the rears of the bus as the buses go through that piece. Since it's not calibrated, it's not fully cleaning the back of the buses. So our service line are using buckets and brushes to mitigate to fill that 5% gap.
Well, and you know, we always recognize that there's such an overlap between the COVID and the service committee concerns, because in COVID we try to stay with the inside because that's where the COVID, and so I remember talking about having the checklist that you mentioned, because it not only gives you the documentation, but it also, for the people cleaning, then it doesn't let them just overlook something on the inside that was important. So that sounds good.
Yes. So as you stated, Ms. Mood, the interiors and exteriors, we've done 607 of those. The overcrowding issue regarding our 801, so we had our safety specialists right along with Eric Harris, I'm sorry. Excuse me, it's probably going to kill me. Right along to see exactly how's ridership on the 801. So it was identified that a tripper will be needed, and a tripper is a vehicle that's sent out to support another vehicle in the event of overcrowding, so that way nobody is left at a stop. So we identified that, and we have a plan in place. When the request is made by the operator to notify dispatch that, hey, my bus is to capacity, we know to dispatch an operator in a comparable vehicle to start picking up the passengers along that line, so they're not waiting for an extended period of time.
Well, do you know the trends of overcrowding? I mean, I would hate to know the intel and not have the trickle close behind, or at least stage to a point where we don't have an individual having to let a bus pass by due to being overcrowded. So I would think that with the trend data that you have, you pretty much know the times where you're going to have a problem. And it definitely, the driver definitely knows it because he knows the passengers and all that. So that's just a thought.
Exactly. Great.
You mean anticipating a tripper rather than having to call?
Yes.
Yeah, absolutely. And thank you for that. The issue with that becomes it varies depending on the day. Whether some folks are probably waiting for last minute to do their Christmas shopping, so that there's a fluctuation in that. The plan was to have the unit stationed at Comet Central, or pretty much centralized, so that way easy to be dispatched and get there as quick and safe as possible, so that way the folks waiting for the ride aren't waiting for long periods of time and don't have to worry about, you know, I just did my shopping, now I'm here, and I don't want to be here, I feel unsafe. So the plan was to have it stationed at Comet Central and ready to be dispatched. But I understand having the trends of the peaks and the valleys of the time of day is very important, and we'll work on that.
We can tie this to service standards, like Leo just said. We tie this to service standards, but the reason why I'm asking is based on COVID and the number of social distancing on the buses and the number of seats that are reserved to promote social distancing. But that's on Broadway Road. But if you take that policy and you try to do that across the county, then I'm afraid social distancing may not work in university settings and bus class schedules and all that, and not knowing the peaks and valleys, as you said, and not using that intel and trying to dispatch from the hub, then that becomes definitely an issue. So all I'm doing is just saying, please give us some more information on the intel and perhaps being able to recognize those peaks and valleys and schedule those accordingly.
And really what we're talking about here is buses where we're not letting people stand. And that's kind of the thing, because we're not able to, we're not skipping seats and things now on the bus. But everybody has to be seated, and that's the main thing. So the ones that we have to send for are where we're not allowing standing room.
Mr. Huggins, and this is Eric Harris, the Planning and Development Specialist.
Yes, sir.
Yes, I was just going to chime in. So yeah, on Monday, we did take a look at 801. We did have a reoccurring complaint of it just being overcrowded on that route. So what our goal was to do was to see at what times of the day is the route overcrowded. And from there, we discovered that earlier in the morning, all the way up until about 6 o'clock, we're seeing consistent, routes being filled to capacity. So what we did, as a result, we also understand that we're trying to explore different options of what next year and some of these service changes will look like. And so being able to scale up service is something that we're looking at in a more incremental way, opposed to putting out so much service where we're oversaturating the route. So this is the first step of many that I anticipate to make sure everyone is safe on this route. But we also are conducting other research with our APC data to see trends over the course of time, and we're collecting that data as of now, and we are hoping to have an analysis that we can provide to the service committee within the next, hopefully the next meeting or so.
Thank you, Mr. Harris.
Thank you.
Mr. Sanchez, any more?
Regarding the overcrowdedness, no. I would like to touch on the barriers.
Mm-hmm.
Okay. Regarding the barriers, we have cutaways complete. We have 2 small vans that are in progress. Out of the navies that came from Nevada, 1 is complete, 2 are in progress. The challenge that we're facing now regarding the big buses is the barrier interfering with the coin box. So the maintenance team is working with the vendor, we're moving the fare box so that way the vendor can come out and complete the installation of the rest of the 31 units. So that's what's going on with the barriers.
So we have all the barriers here, we're just in the process of installing them.
Yes, we just need to move the coin box,
Yeah.
the fare box, so that way it'll be secured and not impeding. Once we go back to the regular new normal, we won't face any issues there.
Let me just add a point on the barriers as well. The minivans, we've identified a new vendor, and we'll be issuing them, we've already issued them a purchase order so that we can get the minivans resolved. We're working with RATP to have maintenance on the barriers as it relates to the trolley vehicles and the New Flyer, getting them some measurements. And then we've directed RATP to have to coordinate with New Flyer to go ahead and at least get 10 of the barriers for our 2010 New Flyer buses, since there's no conflicts with those, so we get those installed while we resolve the issue on the 31. Depending on the outcome of the 31 will depend on the delivery. If we're able to mitigate the coin blockage issue, we can have the project done by mid-January. If we can't and New Flyer has to re-engineer, which we're trying to avoid that path, we're looking at a mid-March to late March before the entire barrier project will be completed.
Just make sure we articulate that in our board meetings, and when appropriate, we let the public know what we're doing too. All right.
And the Finance Committee did hold in committee the discussion about the fares, while we investigate other transit agencies and how if they're still collecting free fares during this period, even with barriers. And, that committee is also aware of the potential barrier delay. And we'll report back to them in January on our findings.
Thank you. Mr. Sanchez, any more?
Yes, I would like to discuss the testing for our team downstairs. So far, that's been conducted by Lovelace. I have it broken down by administrative operations and maintenance, as well as our subcontractor. So to date, since Lovelace has been out, we've conducted 146 COVID tests for our teams. That's 17 administrative personnel, 92 operations, 9 maintenance, and 28 TCS personnel have been tested since we started providing that service to them.
And we still hadn't picked up anybody positive in those testing.
That is correct.
We've had some positives, but not from the testing.
That is correct. I believe this place is more secure than the NBA championship bubble.
In our own bubble.
Yeah, exactly.
Well, that's good. That's good to hear.
That's
good to hear.
So, and again, we had some employees that were feeling under the weather and decided, to go on their own to have their own test done, and those have been one recently, because of Thanksgiving, she went to the beach. She was feeling under the weather. She went for testing and she tested negative, so that's okay. But again, the positives are happening outside of our bubble. So everyone here is as safe as possible.
Good. Any more items from you?
Yeah, I have one more thing. So we have 2 thermostat scanners, one by dispatch, one was relocated as soon as you walk into the building, so you check your temperature. We have one that's waiting for approval for shipment for our maintenance department. So we'll be able to capture all 3 areas, having to do a self-scan to make sure that their temperature is in compliance. That's all I got. If you have any questions.
Any questions from the board? Okay.
I want to add in, Mr. Chairman, if you don't mind, just a point on bullet B, just as relates to further operations, so you're aware. First, we have received approval from Fort Jackson to resume Route 76 service back on base. They want us to do additional cleaning efforts on the vehicles each time the bus goes on to base. So we're coordinating with RATP Dev, and we're looking at a Sunday start date for Route 76 to resume operation. It won't run as frequently as it did before because of the requirements that Fort Jackson has put on us.
How do you do cleaning before they get on the base, and how does that happen?
We'll discuss that.
Well, basically, what we have to do is before the bus actually gets on base, it has to be cleaned same time. So what we tried to do when we
Internally, you're talking about internal cleaning, right?
Right.
Okay.
And what we did is when we looked at getting that done and the number of times we were servicing, is trying to scale that back. So when the buses leave here, that they're going to be cleaned and sanitized here. Or if we have a situation where it has to happen at our super stop at Forest Drive, then we will work with our contractor to make sure it's done there. So we kind of looked at both of those options, and we will have that in place because that was a requirement when we request to get back on base, that this would be a requirement of ours to make sure it's met before each time that bus go on to post that it's been cleaned and sanitized.
I'm just trying to envision how in the world that works, because, I mean, I can see it if you do it here before the bus leaves, but if you do it at the super stop, I mean, we can make everybody get off the bus while they're cleaning the bus.
Yeah, and that's why,
that seems very
that's why we're working, and the way we are aligned is hopefully that it can be done here. I think, and Tanisha, if you wanted to add anything, you can jump in. where we're hoping that that's where it's going to happen. If we get in a situation where it has to happen there, then we'd have a backup plan for there. But
One thing to be mindful too is that we're already doing this type of cleaning in the field anyway. We do have a utility worker that's at Common Central from 12 to 3. And all he does is hops off, on and off buses and does a quick sweep. And that's just we started this back when COVID occurred as a mechanism to ensure that we're keeping the vehicles that are cycling through Common Central clean.
And I can see that better because people are already off the buses and waiting to get on. I mean, I was just trying to figure out how not to make it so, it seems different as a super stop where
It's the same approach that we.
riding through, wouldn't they be riding through that?
They would be riding through, but same thing happens at Common Central too, is that they're also riding through as well. So
we can do that with people on the bus?
we more likely request that the people deboard the bus briefly while he does that quick clean,
Okay.
and then
But that hadn't been a problem there?
it has not been a problem at Common Central, and we've been doing that since March.
Okay.
I think the
Customers have found value to us doing that,
Exactly.
actually.
I think the
Yeah, I think
passengers
they
will
would
appreciate that. Okay, Ms. Sanchez?
That is all.
Oh, and then, I'm sorry, I'm talking, one more other piece. We have also gotten word from FTA that food delivery presently was supposed to sunset on January 2021. They have increased that to January 2022. So, we still have a few organizations we're working in partnership where we're delivering food, utilizing our 2 DART minivans. Unless we have a further direction from this committee or the board, we envision continuing to provide that service, provided that it doesn't impact day-to-day common operations. And it gives additional hours for the workforce, that it provides good community will.
Very good.
And then the last piece is to improve the cleaning of passenger seats. We've been investigating changing our cloth seats to soft padded vinyl seats. This is hoping to eliminate or reduce the issue of bed bugs. And then we also have some challenges with people defecating in our seats. So, yeah. 801 is the pilot bus where we're doing this test. And we just finished the back portion of the bus, so we'll evaluate passengers' feedback on it, and then we'll report back to this committee. If we ultimately decide to retrofit the entire fleet with vinyl seats, we are looking at a cost of about $304,000. So we would require this committee to recommend to the board that action, since it does exceed staff's spending authority to that matter. So far, we're hearing some positive feedback, but we'll give you full feedback after we let it run for a month.
Okay, so I'm gonna ask that make sure that, that line item, which you just spoke about, and also the Fort Jackson, situation that we got going, how well that's going. Just keep us up to date on that.
And then our 2 new cutaway buses also have the vinyl seats as well that are running on our rural routes 47 Eastover and 97 Batesburg-Leesville. So I have on these.
All right. Is that item G, the UV technology?
And that's an F.
Okay, I'm sorry, I skipped F. Okay, I'm sorry.
Yes, I'll take this one. As you know, I think today is the day we may hear that the FDA has approved vaccination to the general public. And CDC and DHEC have both released plans, which I've given this committee copies of their plans on how they're going to release the vaccine to people throughout the United States. There is a push by the American Public Transportation Association and ATU to ensure that public transit workers are included in the essential workers category, which under CDC's plan, it could be either phase 1B or phase 2, which means that, assuming that the vaccine is approved today or sometime next week, that within a month, that it'll be as part of phase 1B, if we're in phase 1B, that public transit workers will be able to have access to the vaccine. This phase 2, we're probably looking at 2 to 3 months. AFTA's going to be having a discussion about this next week. It is unsure, even though there has been some rumors that FTA might make this mandatory for all public transit workers if this is implemented. We did have to respond to a survey to Region 4 about public transit agencies wanting to be considered as part of the first distribution of the first phase. So information is a bit limited right now, but DHEC has developed a draft distribution plan. The governor has announced that as of yesterday. And as we get more information about how the vaccine will be distributed, we'll definitely keep the committee apprised.
Well, John, when you say public transit workers, I mean, is that all inclusive, everybody who works for a public transit agency?
That's a good question. That,
Because what I'm thinking about is I've heard some of the discussion about healthcare workers. And what I'm understanding at this point is that, you know, say, for example, Prisma Richland would get a certain number of vaccine doses, and then they have to decide who gets priority in terms of getting those. And that for healthcare workers, they're focusing on who has direct contact with patients. You know, that's the top of the priority, which in our setting, it seems to me, would be the bus drivers. You know, they are the ones, and so that if we get fewer doses than would take to cover everybody who's employed here, we start with the ones that have direct customer contact. Is that?
I would think that'd be, assuming that CDC and DHEC leaves that determination to the organization, then I would think that'll be my personal recommendation to this committee, is that all front-facing employees that have some impact or direct relation to a customer should be the first ones to get the vaccine.
I would, if you have to further prioritize that, I would put the DART drivers highest because they're dealing with the most vulnerable riders.
Vulnerable population, right.
So that would be what would happen in my head.
Definitely.
Okay. Item G.
We've been advised, we haven't not made any commitments, though, but we've been advised by the Santee Lynch's Council of Governments about this far UV technology that can be placed on buses that can effectively kill pathogens without harm to human tissues. They are very excited about this, and they've been working with Santee Watery RTA about implementing this on their buses. And they would also like to reach out to other RTAs in the state to see if we're interested, because if we bought more of these units, the buying power comes down. We had a conference call with them about this technology, and we read some of the materials about it. We would like to, we've asked them if they would consider a pilot so that we can actually see how this can work, understand the implications and operational costs related to this before we make any long-term investments. It is $2,700 based on, if they were just to order with us, Santee Watery and themselves, fully installed. If we ordered more than 200 units collectively between more RTAs, the price can start to come down.
That's per unit.
That's per unit, yes. The lifespan, though, is 3,000 to 6,000 hours, depending on its use. On the lower end, 3,000 hours is about 12 hours of use for 250 days. So that's an average average amount of weekdays in a year. And so questions that we've asked of them is, what happens when you have to replace the unit? Do you have to take the whole thing off? Do you have to spend another $2,700, or are there refill cartridges? I'm just bringing this to the committee's awareness that their transit agencies are starting to look towards this technology to address pathogen issues and also air infiltration issues to keep the air pure on vehicles. And as we get more information, I'll definitely share this with you.
Well, I don't want us to put ourselves out on a limb, because you're going to have that are coming up with this type of technology, and I would be more interested to see what our other agencies are doing, but more in that, I want to see what FTA has to say about it, and then even our local DHEC officials and all that. So I would caution you not to spend too much. I want you to spend the time on it, but I don't want this technology to go past go out look from FTA, DHEC, and whomever else.
Agreed.
Okay.
And we use the APTA calls to engage with other transit agencies so that we can learn from them.
Mm-hmm.
We have a great relationship with DHEC staff, and they've been helping us along the way. I do want to piggyback on that comment on DHEC staff, is that we're also working on with DHEC staff to do COVID testing at Common Central, Wednesdays through Saturdays. I believe we're looking at 7 a.m. to 2, and then 2 p.m. to 6 p.m., Wednesday, Thursdays, and Fridays, and Saturdays from 10 to 5. And the purpose of allowing this is to, one, make sure our most vulnerable populations that don't have time or availability to go get COVID testing, as they're passing through Common Central to connect to buses, they can get a quick COVID test. It'll be inside a secure kiosk at the far corner of the facility, away from people, so that people are going in there in a safe and secure manner. And this is another way of just us having good community will in the community and furthering our partnership with DHEC on this matter.
I think that's real exciting because what we know for sure is that a lot of our bus riders are in high-risk groups. And you're right. I mean, they go into work and coming from work, and they can't go get in a line somewhere for a test. That's great. That's great.
Very good. That was our last discussion item. Any questions from the board or staff? Any contributions? All right. Is there a motion to adjourn?
I so move.
I second. All in favor? Aye.
Aye.
Meeting's adjourned. Thank you, everyone.